The U.S. Surgeon General believes our nation is in the grips of an epidemic, one that is equally as dangerous as the COVID-19 pandemic and its variants. A lack of trust, willingness, and due diligence to seek science and fact over fiction when it comes to the COVID vaccines and the virus itself. Paula Tutman joins us live from Henry Ford Hospital in Macomb County, where a cardiologist is sounding the alarm. Hi, Paula.
Yeah, hi, Jason. You know what? She certainly is, and she's not the only one. This really is the talk of the medical industry. I mean, when you hear the word epidemic to describe misinformation and disinformation, and frontline workers believe this is costing lives. No one visits a cardiologist for elective or cosmetic reasons. By the time you're referred to a cardiologist, you potentially have something life-threatening or life-altering going on in your health, which is why vaccine virus misinformation and disinformation are so concerning to Dr. Letletha Rudraya, a cardiologist at Henry Ford Health System, Macomb.
I start off my day by asking them if they've been vaccinated or not, and some people get angry and they just storm out of the office.
What she is seeing and hearing from some of her clients, conspiracy theories about the vaccine, and the most concerning, that the virus, 17 months after it started infecting Michiganders and killing more than 4 million people across the globe, some of her patients still believe the COVID-19 virus is a hoax.
Despite all the deaths we have experienced, despite the statistics out there, people still believe this is a farce, which is very unfortunate.
But also deeply concerning to her is that her patients are at greater risk of dying if they get COVID.
Most cardiology patients are sick as it is. They're older, they're diabetics, most of them are having high blood pressure, they're overweight. And we know over the year and a half that these are the risk factors that actually is the worst outcome when they get infected with COVID.
She and healthcare providers across the state and the nation are perplexed, but also deeply bothered about the level of disinformation, which is deliberate, and misinformation, which is generally misunderstandings of the science.
It's not controversial in the medical world, it's only controversial on social media. So I don't know how to steer these people in the right direction. I think that people are reading misinformation on social media.
Unfortunately, there's just so many sources out there that are full of misinformation and in many cases, outright lies.
Bob Riney, the Chief Operating Officer for Henry Ford Health System.
We should all be on the same team. And we've turned it into something divisive.
He says close to 100% of the COVID patients currently in his various hospitals are unvaccinated.
This Delta variant is very, very contagious. And our lab positivity rate, went from 1.5% to 3.6% just this week alone.
And at this point, he believes disinformation and misinformation are as dangerous as the virus itself.
But what I tell people all the time is that, social media vehicles are great for social purposes, but they are not intended to be used for research.
Yeah, where you get your information is really, really critical, particularly with this Delta variant, because if it does get hold, it could actually morph itself to actually threaten those people who are vaccinated against this strain of COVID-19. So we're talking about a different kind of variant. Also, Michigan Department of Health and Human Services, also deeply concerned, sent me a statement this afternoon saying that getting the COVID-19 vaccine is our best defense against the virus and the way we are going to end this pandemic. They too urge that people get their information from certified science-based places and not their friends and social media, Jason. This is critical at this point.
It's absolutely astounding, Paula, just the war on science. And, I'm glad you talked to the cardiologist, because when they tell you to do something, your doctor says you have high blood pressure, I don't go to social media for the second opinion. You go to a doctor. Yeah. Paula,
absolutely.
thanks so much.
Yeah, good point.
Very important information there.